So we have this morning, very, very pleased to say, members from the Ministry of Health. We're going to be talking a bit about some things that have popped up on the radar. So we've got the national epidemiologist, Ms. Rachel Corbett, who's joining us, along with CNO Felicia McLean. So let's go ahead and do a virtual welcome to them, hands clapping and all. So good morning to Ms. Rachel.
Hi, good morning. How's it going?
Good. How are you?
Yeah, I'm very well, thank you.
Awesome. We've got Miss Felicia also joining us. Good morning, Miss Felicia.
Good morning.
So nice to see both of you here from the Ministry of Health and Wellness this morning. So a couple of things on the radar that we have been reporting on and watching. Now, who can give me the correct pronunciation of the virus? Is it Oropouche?
I think it's being said both ways. Oropouche. I don't think there's an issue with either.
Okay.
I think Dr. Jen has kind of named it that Oropouche.
Yes. Yeah. All right. So we're going to be talking about that as well as Mpox this morning. So, the ministry has issued some advisory on both of these. So let's start with the Mpox one, because at least we're a little bit more familiar with that one because it was previously called monkeypox. And of course, the name was not politically correct. So they have now changed the name. So what is it that we know about Mpox as it's continuing? It seems like to really pick up some speed now in terms of spreading in communities.
Yeah, I'm sure you've seen going on in the news. So since the kind of global outbreak that happened in 2022, global cases then declined a lot. But there was still cases continuing, particularly in DRC in Africa. And this year, transmission there has really picked up. So they've had more cases since January, the beginning of this year, than they did in all of 2023. And they've had a number of deaths there as well. So they've had around 15,000 cases. It's probably a higher number than that, but that's what's being officially reported at the moment this year, and over 500 deaths. So there's been an uptick in transmission, but it's also been being detected in kind of areas that haven't been affected previously. So that's always something that's a little bit more concerning to see. Okay, it's spreading to new places. And it's also spread out of DRC into some neighboring countries. So Rwanda, Burundi, Kenya, and Uganda have all been reporting cases. And some of these individuals have had direct links back to DRC. But the other thing is that why we know it's kind of spread from DRC and out to these places is that it's the same clade or variant type. So what was circulating in 2022 was clade 2 that caused that global outbreak, but what's circulating in DRC at the moment is clade 1, specifically clade 1b, and the cases that have been detected in those neighboring countries are also clade 1b. So that's kind of what has led to a kind of increased risk concern, really, and to the World Health Organization last week declaring it a public health emergency of international concern.
Yeah, so I think that that's important because obviously the World Health Organization has been watching it, and there's certain things that are required for the WHO to declare something as a national emergent. What's it?
International. Yeah, exactly.
Yes, emergency. Yeah. And so this is interesting. I see Damien just mentioned this as well, that the Philippines has reported its first new Mpox case with no history of foreign travel. So we kind of see where, you start to get local transmissions happening within communities. And this person is a 33-year-old male patient from Manila who experienced fever before developing this distinct skin rash. So tell us a little bit about what the symptoms are of Mpox, because I think it's important for people to maybe know what to look out for. And do we have any reported transmissions as yet in the region that you're aware of?
Great questions.
Yeah, sure. So the tricky thing with this is it's The symptoms are very common until we get to the rash. So fever, obviously being one of them with any virus that you would have. General malaise, headache, low energy, muscle aches are all things that people would feel in the early stages of the disease. And then later on, they can develop a mild to severe rash, most commonly on the hands and the feet, but it can also be in the genital area. And so it's just kind of looking out for these bumps. Obviously, they're going to probably in the beginning maybe resemble something like a chicken pox in that regards, but then they still have a more distinct form in the rash. So we're kind of advising people to be mindful of those facts. We don't have anything currently in this region just yet, thankfully. However, with travel, as we saw with COVID, it is something we want to look out for because we travel all over the world now all the time. And so you just never know. And so we're within the ministry and within our local key stakeholders, we're just really staying on top of the game to get ahead of it, to ensure that people are knowledgeable, to ensure we know what to do if we do have any suspected cases here, so that we minimize that spread, because it is very contagious from person to person, at least this version of the mpox.
So, I mean, I suppose without a doubt, this is something that's extremely concerning. You talk about this outbreak in the DRC leading to the World Health Organization declaring it a global public emergency, which is its highest form of alert. And that outbreak was, of course, impacting and spreading to neighboring countries. So this is kind of how, it works. Even if you have like a ground zero, once you see that spread begin to happen across the region, then it becomes a question of not if, but when, really, right? So Sweden on Thursday reported its first case. And like we just said, the Philippines also have its first case of non-travel related, which means that it could now be sort of local in the community. So can we talk about how this, the one in Sweden, by the way, was the first case of the variant outside of Africa. So again, that's kind of how it begins to jump around the world, right? So what do we know about how it's transmitted?
Sure. So there are a number of different ways that mpox can be transmitted. So it can be through kind of any bodily fluids. It can also be through respiratory droplets, so coughing. It can also be through contaminated surfaces or items, so things like bedding or towels. And it also can be transmitted mother to child, so vertical transmission. Something which was talked about a lot when the outbreak happened in 2022 was it was being transmitted a lot through sexual networks. What we're seeing this time is that that's often how an incursion into a new country has been happening, but actually then the onward transmission locally is much more close contact within households. People touching, the scabs on someone else's skin, or particularly through those contaminated surfaces. So really it's a number of different ways. And it's not as is being thought before, particularly through sexual contact. It's through quite a few different ways. So I'd say, risk to everyone, especially in households, is there. And like you're saying, the something to kind of keep an eye out for as you see things being reported around the world. There isn't just this kind of clade 1 circulating at the moment. So that's what is circulating in DRC and that outbreak, but in other parts of Africa, other countries, clade 2 has continued to be there. It hasn't been kind of picking up in the same way it has happened now in DRC, but things like that. Philippines report would be really interesting to see when they do release information on what variant it is, because it could be related to either, with the interconnected world, moving from one country to another. It's definitely going to happen. And like you say, if it's a non-travel related case, that likely indicates it's already transmitting in the community.
Yeah. And Pakistan also on Friday confirmed at least one case.
That was clade 2. So that's what's interesting. So that's not what's driving the overall
right.
larger
So already there are
outbreak.
variants out there.
Yeah, those are two main clades, K1 and 2 for mpox, but there could kind of be subgroups within that.
Interesting. So now, of course, everyone I'm sure who's listening to the program is thinking, "Oh God, not another pandemic, not another lockdown. What are the experts saying around the world about the possibility of this being the next COVID, if you will?
Well, we're in quite a different situation for this than we were for COVID. So, for example, having had the 2022 multi-country outbreak, we learned a lot about mpox at the time, but we also knew a lot about pox viruses already with smallpox and chickenpox. So we had a much larger base knowledge already, but there are also some vaccines that are available for mpox, whereas with COVID we were really starting at nothing there in terms of the vaccine situation. So it's a slightly different picture, and the clinical presentation for mpox is quite different. So with COVID, a lot of people could be asymptomatic, and whilst that is possible with something like mpox, it isn't likely to happen to the same extent. The clinical presentation is a lot more obvious. So your case detection is likely to be a bit higher. So I think, we're in quite a different situation. We've got more tools, we've got tests for it, we've got some vaccines, which right now really need to be focused on the African continent. But we have some options, and so I don't think it's quite as unnerving situation as COVID, but we still want to be ready and make sure we've got things in place that we can use.
And to add to that, the good thing is that while the particular virus might be more deadly or harmful in particular countries they're in, when you look at the population and the health status of our current population and others within the region, the idea of the virus, it shouldn't be as deadly or as impactful in that regards to our community, because we don't have as the large volume of HIV or hepatitis or tuberculosis kind of conditions that you would be seen in other areas.
Okay. All right. Well, Pakistan has decided to start screening all travelers for the virus. But of course, the World Health Organization is, saying we don't need to go to the extreme of doing anything like closing borders or imposing any sort of travel restrictions. Really, it's more of, I guess, a monitoring situation in terms of disease outbreaks and control. So we'll see what's next. It's very much a developing situation that we have to just be mindful of, I suppose.
Yeah, and things like testing at the borders has different effectiveness for depending on what you're looking for, and so I think we'll see how the international guidance develops and changes over time, but it isn't something that we'd jump to immediately. I think it's very much ensuring that clinicians know what to be looking for, and we have really clear processes in place of how people can get tested. And clear communication so the public are aware and they know what's going on, and those really are our best tools at the moment.
And then on top of that, just ensuring, as we say, knowledge is power, so letting people know that this is what's happening in other parts of the world in case they did have any planned travel to those particular areas. It would be something to be aware of, you know what I mean, ahead of the game.
All right, folks. So again, a couple countries already reporting cases. The Democratic Republic of Congo, of course, has seen over 27,000 cases, more than 1,100 deaths since January of 2023, largely among children. So I think it's interesting in this case that unlike COVID, which had a lower infection rate as well as death rate with children, this one seems to be quite the opposite in that regard, in that young children are at greater risk, if you will. Sweden has now...
And just a comment on that, Sandy, I think that also could reflect a little bit more the population that's being affected. So there's quite a high level of malnourishment in DRC, and that will impact the immune system quite a lot. And so it's helpful just to think through some of those kind of contextual elements, that whilst it is being reported to be impacting those under 15 years, particularly there are a number of different thoughts as to why that might be, also not least among things like stigma that might be impacting adults coming forward for testing in the same way, but also the underlying health status of the population there, and less likely that we'd see those same demographic trends in cases that appear around the world.
Okay. All right. So 2 strains currently of this mpox. Sweden reporting the first case on August the 15th, first confirmed infection with a new strain of the Mpox virus. And its first spread outside of the African continent. And then, of course, quickly it went to the Philippines, but other places in Africa, including Kenya, Rwanda, Uganda, also reporting cases as well. So, okay. Anything that people can do? I mean, you say that there's a virus. How effective is this virus?
Sorry, you're referring to the vaccine?
Oh, sorry, my apologies. The vaccine.
No, it's okay, no worries.
We're not trying to.
There are a couple of vaccine candidates. There is not a large amount of global supply of the vaccines at the moment. So really, what the kind of global community is advocating for is that these are really focused in DRC and where the outbreak is really taking hold at the moment. Often the kind of global challenge in these situations is that wealthier countries are able to develop the vaccines themselves and have stockpiles and protect their populations, which makes a lot of sense. But really, when you're talking about something which has global impact, we also really need to be supporting those countries addressing where it's happening. So we're not kind of encouraging people to be getting vaccines here at all at the moment. And that's really the kind of limited availability of it is to be focused where it's most needed at the present time.
Now, there are some people who are sponsoring African trips coming up here shortly. Do you think that those individuals, I mean, some vaccines you have to do like certain months ahead of time to have, sort of this effectiveness. Should any of those persons be concerned if they're going to be like in South Africa and so on?
I think it depends a little bit where in Africa they're heading to. I would encourage anyone who's planning to go to DRC to put that trip on hold right now. I would not say that's a wise move, and just would say if possible, please delay those plans or see what else you can do instead. There have been some cases of clade 2 in South Africa, but it's not been transmission spreading in the same way at all as what we've been seeing in DRC. But I think it's just kind of consider whether now is the best time to be making that trip and keep yourself updated and aware as to what's going on through the kind of official global channels, things like World Health Organization. They always put out their bulletins and their updates on these situations. So make sure you know what the situation is there. We don't have those vaccines here for travelers to take at the moment. The advice would be if you're looking to go to the places most affected, please don't really to protect yourself.
But even outside of that, as you mentioned, Sandra, and some countries already putting in some type of travel restrictions, we want to be mindful when we're traveling towards that area that, if the situation changed and they decided to close borders, can I get back? That kind of way. So as Rachel said, we're kind of like just saying, be wise at this point in time. If you don't have to go, don't necessarily take that trip at this point in time, because it could be anything can change and anything can happen in that regards.
Very interesting for sure. So we'll certainly be keeping an eye out on the situation. Let me just see. Inspiring says, morning, what a hot mess. Another pandemic is coming. So of course, I suppose when people hear of something like this, that is the first thing that kind of comes to mind, right? So information is key with these types of pandemics, of course, and no need to panic at this stage. It's just more for informational purposes. Just make sure that you're keeping an eye out on exactly, what's happening. So that's the key here, key messaging.
Absolutely. And I think, COVID really changed the game because it was something that everyone experienced. There are things like this that are happening relatively frequently in different parts of the world. Some we hear about more than others for different, levels of risk concern. And so part of us coming on and talking about it really isn't to cause alarm, but really to make sure that people are aware and they can make the right decisions for themselves in terms of travel and things like that. I don't think right now this is something that we're saying is going to be a repeat of the COVID situation at all. But we could well get cases in Cayman. So we have the test ready. We've made sure all our clinicians are aware. So we've got all those things lined up, but it's not something to be overly worried about.
Overly worried about at this stage. Yeah. Okay. All right. Good morning to Miss Barbara. Damien says South Africa as well. Emma is tuned in. Damien asking if we have any supply of vaccine? Like, what's our capacity in terms of like testing and vaccine availability for this?
So we have testing capabilities. So our molecular lab at the Health Services Authority has had an mpox test available since the 2022 outbreak. So we're very ready for that, and they can do pretty good high throughput, and with results coming back on the same day, which is amazing. We don't have any vaccines at this time, like I was kind of explaining about the global availability, but that's something that we'll look into if the need arises.
Mm-hmm. And the thing is going on there is that, while WHO has created, kind of put forward this emergency, it allowed Cayman Islands and the ministry to work with the key stakeholders to put things in place. So, having that meeting ahead of time, seeing where our lab is and how ready it is to stand up to meet the need, if that was the case. Also to talk with different key stakeholder hospitals. We met with Doctors Hospital, Health City, obviously HSA. We've got a plan in place in regards to, which people will see coming out soon, in regards to what to do if you think you have that you might have caught it, because people are still traveling. We don't know where they might have come from prior to yesterday. You know what I'm saying? So in the event that someone did have the symptoms that wanted to be seen, there's a pathway in regards to not going to the hospital. We don't want to increase it. If you think you have it, unless you're seriously ill, we're going to be asking people to call one of the 4 major centers to get instructions about coming in, where they can isolate you, coming in by private car, preferably not taking public transportation, just to be ahead of the game. I think if we want to take anything from COVID, is that we think about it better now. We're a bit ahead of the game in regards to how to plan, how to ensure that we have what we need to do to minimize any spread within the Cayman Islands if it does come here.
Wow. So we do see, just by way of information, with this new clade, clade 1 has been deadlier than clade 2, killing up to 10% of people who got sick. But most recent outbreaks have had a lower death rate, which I suppose is good news. They say that basically the fatality rate for this latest one is about 5% as opposed to 10%.
But again, this is based on kind of, as we talked about, the kind of background health situation. Most of this data is coming from DRC, and about half of the cases being reported have got HIV, which will also be contributing to that mortality rate in terms of being immune compromised. So yeah, you're right. I think it's about 4 in 100 is the current overall statistic for the mortality rate, but we don't expect that to kind of follow through if cases occur around the world.
Yes.
We expect that to be much lower.
Because healthcare matters.
There's also another big key element. Yeah.
How healthy your population is. Okay.
Yeah, and what care they have access to. So that will be much more limited in DRC.
Right. Okay. All right. So Young Audacity says, well, if how about quarantine after their return if somebody's traveling? So what's the incubation period for this one? I know we talked about transmission taking multiple forms. So to be very, very clear, it seems to be extremely, skin to skin contact with rashes or saliva or mucus, sexual contact, contaminated materials, infected animals. So if you're hunting, trapping, cooking, touching any kind of sick rodent, or you get scratched by these, like, it spreads in a lot of different ways.
Yeah.
So how soon after infection do you start to see any symptoms? And as Felicia said, the thing about it is probably the early symptoms mimic a lot of other things, just like a regular cold, flu, or whatever, right?
Exactly. The incubation window, it can be quite long. It's generally 5 to kind of 14 days, but it can be as much as 21 days. So that's quite a long window. Yep. So that also kind of comes into play, especially with things like travel. If someone has been in an area where they may have become infected, they might not realize for a few weeks and then travel somewhere else. So that really plays into kind of the dynamics of us understanding how it's spreading and how quickly we become aware of new things. That's also why when you're talking about the example in the Philippines, if you've had that long time window and people aren't aware that they are infectious, they can easily then be infecting other individuals. So we're not looking to quarantine people. I think the comment was about quarantine after travel. We're not looking to do that at this time, but if somebody contacts, what we're asking to do is to phone one of our main 4 locations. If someone phones through saying that they've got symptoms, we will be asking them to kind of come in to a designated place that they are isolated when they come to a hospital, to ensure that there's no further transmission happening to other patients or in kind of waiting areas and that sort of thing. And once they've been tested, if there is a positive result, then we will be isolating them until they're no longer infectious.
And just to add on to that, it would be them and their family, because the thought process is, yet again, it took 5 to 14 days or so to even maybe get to that point in time, which means that they've all would have had contact. And so that immediate household would be asked to isolate as well, if we get to that.
Okay. All right. So that's as much information as we have at the moment on this virus. But let's move on to the other one now. So this one is again, I'm not even sure where I hadn't even really heard of this one, but we also had an advisory on August the 9th from the Pan American Health Organization issued a warning that the risk of transmission for Oropouche virus, not sure which one to go with.
Take your pick.
In Central and South America and the Caribbean is now of significant concern. So what on earth is this Oropouche virus?
Yeah, so this is another virus that isn't actually new. Again, I hadn't really heard of it before kind of 6 months ago, so we're all constantly learning. It was first detected in the 1950s in Trinidad and Tobago. It was first detected in an area along the Oropouche or Oropouche River, so that's where the names come from. And it's been circulating in the kind of Amazon region ever since, with outbreaks happening in the last kind of couple of decades or so. But the reason that PAHO have changed their risk assessments, so last week they increased their risk assessment for the America regions as a whole from moderate to high. And that's basically because we've seen some changes in the epidemiology of the virus in the recent months. So again, there's been transmission happening in areas that weren't previously affected. So there's been cases being detected in Brazil, but outside of the Amazon region. So that was kind of one early indication that it's spreading to new areas. But there's also been quite extensive case reporting from Cuba. So again, showing this is, obviously quite a big jump to Cuba, and it's not just in one area of Cuba. It's kind of been across 9 of the 15 regions, so it's quite well established there. So there's been that increase in transmission, but along with that, there's been a few more worrying indicators. So, for example, there's been the first deaths that have been reported to be associated with the Oropouche virus. There have been 2 women in their 20s in Brazil, and this is the first time that we've kind of had deaths attributed to it. And sadly, there have also been some fetal deaths, and there are some investigations ongoing into a couple of cases of microcephaly among newborns. So this is just kind of all these factors together have kind of shown that there have been some changes in the risk profile, and it's looking to potentially spread, to more areas, seeing as it's already in Cuba. So that's why the risk assessment has changed.
And of course, this one is spread by the bite of infected small flies and mosquitoes. Now, Felicia, you got to help me here. When they say small flies, are they talking about like sand flies? Like, what are we talking about here?
Yeah, definitely. Yeah, that's the trick. They are talking about.
Yeah. Okay. All right. Because I thought, God, do we have something new that I've never even heard of before? I don't know what small flies are, but yes. And gosh, they can bite you and you don't even know.
Yeah.
Afterwards. Wow.
Yeah.
Some parts of Bolivia, Brazil, Colombia, Peru, reporting cases now. Cuba. So it's now considered a level 2 travel health notice, which has been issued for Cuba by the CDC. Oh my goodness. So the thing here is, if you can prevent bug bites, you might be able to, I guess, starve this one off.
For sure. But I mean, we live in Cayman, and we're used to the sandflies, and we're used to the mosquitoes, and we do all we can anyway. And I think it's yet again a reminder for the public to be vigilant in regards to using the repellents, also in regards to emptying out any standing water in their area, not letting that fester. So being mindful of those things so that we're not increasing the mosquito population in that regard. I know MRCU is doing its bit to minimize what it can as well in that regard. So it is a joint partnership in doing what we can. But, you know, we aren't new to this. So I think if we just are are diligent in doing what we need to do and being mindful of it, that would help a lot in regards to just seeing how this goes. And we're just like, you know, yet again, education, knowledge is power.
And especially for people traveling, to be aware if you are traveling to South or Central America to take those precautions, but particularly if you're a pregnant woman or trying to conceive, then really think twice about going to these places. It really might not be a good time to be traveling there. So please do seek out advice on that and be very, very cautious if you are traveling, especially to that region.
Yeah. And so, of course, level 2 means practice enhanced precautions. And you say particularly for pregnant women or someone who's trying to get pregnant, they're saying to reconsider non-essential travel to Cuba at this time.
And South America. Yeah, Cuba and
just South America, generally speaking.
Yeah.
Wow. Huh. Oh my gosh. So they should prevent bug bites for 3 weeks after travel to avoid possibly spreading the virus to others in the US. Well, how would you do that? Tell the mosquito not to bite.
Yeah, that's the tricky part there.
And even worse for the sandflies, how do you tell them not to bite?
Exactly. But now this makes sense because I know the MRCU has been extremely diligent. And in fact, I think they sent out an advisory today. They're coming on the program tomorrow morning to talk about their increased efforts, because we had people who were complaining about, oh, I see the MRCU in my backyard. Well, you should probably thank them for coming out and being concerned about, you know.
They do an excellent job. And, you know, whether it's just from nuisance of being bitten or whether it is infections that are spreading, you know, this is something that affects all of Cayman. So they do an incredible job at trying to make sure that we know what we need to be doing, but also going around yard to yard, as you say, and making sure that we're trying to limit as much as possible the kind of the breeding sites and the possible places that these mosquitoes, especially around homes and in close proximity to where people are living.
Right. And use bug spray, repellents as much as you can.
Long clothing as well is advised. You know, we all want to exercise. So if we got those longer exercise plans, and if we have those longer shirts, you know, a little bit of sweat wouldn't be a bad thing while we're exercising, but that would be an extra precaution in that regard.
Yeah, and you know, I appreciate the bugs are generally around, but dawn and dusk is when they're most around outside. So if there are kind of half-hour windows or an hour window where you don't need to be outside, that will also have a big impact on limiting getting bitten.
Okay. So symptoms include high fever, headache, muscle ache, stiff joints, nausea. They say it mimics dengue a lot.
Yeah. Correct. So it's also an arbovirus, which is what dengue is. So there's this group of viruses: dengue, Zika, chikungunya, Maro, as well as Oropouche. They're all kind of from the same family, and they have very similar symptom profile. So yeah, the good news again is we do have a test for Oropouche here at the molecular lab. So if you're presenting with a fever plus one of the other symptoms, muscle ache or headache, then please do go and see a doctor or GP, and they will arrange for that test to happen. And
they'll run several tests. They're not going to just do it for that one. So we'll catch anything that we think could be within this this virus trend.
Yeah, we'll include a panel that covers all of those I've just mentioned, as well as malaria and COVID and influenza, just to kind of cover all bases so that we can be sure that we're catching that early if it is here.
And it seems like this one is a slightly different sort of incubation period, but about 2 weeks after travel, you should be mindful of any of these symptoms.
So again, it can have that delay and that lag.
Right. And a key thing here is not to take aspirin or any form of like ibuprofen or anything like that to reduce the risk of bleeding. So if you have symptoms, what should you do with, you know?
Well, Tylenol is the best, but at this point in time, as we mentioned, you know, we're trying to also surveillance the area. So while a lot of these symptoms could go along with the flu, You know what I mean? These are the times where it doesn't hurt to go by your GP and say, hey, can I have traveled, or I've been in contact with someone who's traveled recently. I'm feeling these symptoms, and just get it checked out. But Tylenol will work great to reduce the fever, which is usually what they are, and help with any pain. And that would be preferred.
Okay, I see. All right. Wow. My goodness. As the world burns.
Never rains, it pours, hey? It all just comes at once.
But the good thing is we're ahead of the game. We've got the ability to test. We know what to look for. We're educating our public, and that way we can all make wise choices and do our best to keep ourselves safe and the Cayman Islands safe. So I think we're in a good standing in that regards, for sure. Better than we were at COVID, but we didn't know it was coming, and we had no clue, never heard of it, and we had to try and do all of those things to play catch up. We're not there, so that is the good news from all of this crazy.
And we have, an incredible team that comes together on all these things, and we've done a great job of ensuring that dengue doesn't become endemic here with the outbreaks that we've had recently. So we've got a well-oiled machine in terms of responding to these types of situations.
Right. All right, folks. So there you have it. We'll continue to monitor these. Thank you so much for coming on the program today. Paul, good morning to you. We'll touch bases with you in just a second. Morning to Miss Marva. Damien says, have your guests ever heard of gain of function? Miss Rachel, any clue what that's about?
It's not ringing a bell, I'll be honest.
Okay.
I'm not quite sure what the context of that is, but
kissing
very
bugs
happy to hear
or
more.
vampire bugs. I don't know what those are.
Me neither.
No, maybe we need a little bit.
Maybe a question for the MRC YouTube.
Good morning to Miss Alba. Let's just see if we have any questions coming in on the WhatsApp thread this morning. So this person said, good morning. Yes, good question about the vaccines, because, I don't want to hear about an outbreak in school and then there's no vaccines available. I think they were talking about Mpox earlier. All right. Yeah. Okay. Well, we'll keep an eye on these things. Thank you so much, ladies, for coming on and keeping us abreast of what the ministry is doing in relation to these. And it's good to know that we have the capacity for testing, where vaccines are possible. We've got vaccines on hand or available to us. And we'll just continue to sort of, watch and see what happens next.
Yeah, absolutely. And as things change, we'll keep monitoring and keep everyone informed. And there's obviously a lot of international focus on this at the moment, and things like vaccines. There'll be a lot of money being thrown into that to try and increase stockpiles. So while we're saying we haven't got it now, that can easily change. So, but just for now, it's really be aware if you're traveling, is that essential travel? Do you need to be doing that? And if you have any of the symptoms that we've talked about, then please follow the guidance of that's going to be coming out very shortly, which phone numbers to call to go to one of our designated places where they've got the process set up.
Yeah. And of course, so many lessons, I'm sure, ladies, we've learned because of COVID. If we need to set up, emergency testing locations, we're ahead of the game now because we know what worked and what didn't work, and lots of, good learning opportunities there.
Definitely.
Yeah. All right. Very good. Let me just check my other line over here. I see someone messaging on the WhatsApp number. Let's see if they had a question in relation to this. I've got so many phones that I need to monitor at one time. So let's see. And of course, phone lines are open, folks, 936-2626. If you had a question for our guests before their departure, let me just see now. So we've got someone saying, what about vaccines for those who can't have them? I need to know because I'm one of those that can't have live vaccines. So, I don't know much about the Mpox vaccine, but not all vaccines are created the same. So there are some vaccines that a person might be able to have and some that they won't be able to have. So that could
correct. Yeah. And there are a couple of different candidates at the moment, and I don't know all the full details of how all the different ones are made, or there are some that I'm sure are going to be coming online as we go. So again, that's something that we'll keep an eye on and keep looking into as that develops. But currently none available on island. And
don't assume just because you might not have been able to get, say, for example, the COVID vaccine, that's going to bore true for future
Exactly.
vaccines.
Mhm,
Yeah.
mhm.
All right, very good. All right, thank you so much, ladies. Again, that was Miss Rachel, who is our island's first epidemiologist. She's the national epidemiologist for the Ministry of Health and Wellness. And CNO, Miss Felicia, remind me of CNO again, Chief
Nursing officer.
Nursing Officer,
Mhm.
Miss Felicia McLean, who is joining us. And of course, many in the community will know her formerly from the Jasmine organization. Been doing amazing work for a very, very long time. Thank you so much, ladies, for coming on the program today.